Welcome to Medigap TV, real answers about Medicare in plain English. If you've been shopping for a Medicare supplement plan, there's a good chance you've landed on this question. Plan G or Plan N, which one is the right call? And if you've done any research online, you've probably gotten a table that shows you side by side coverage and then nothing else. No real explanation, no honest context, just a table. Today we're going to do better than that. Hi, I'm Loran Marms. I've been a licensed Medicare specialist for 16 years, and I work with clients on both of these plans. I don't have a dog in this fight because at the end of the day, we will do what you feel is best for your situation. I'm going to show you exactly how they're different, what the real numbers look like, and how to figure out which one actually fits your situation. Let's get into it. Plan G and Plan N are the two most popular Medicare supplement plans being sold today by a significant margin. Most people turning 65 are choosing one of these two. The reason is pretty simple. Plan G gives you the most comprehensive coverage of any plan available to new enrollees right now. Plan N gives you coverage that's almost as good but at a noticeably lower monthly premium. We'll go through both of them fully, but I want you to understand the basic landscape before we get into the details. These are both solid plans. Neither one is a bad choice. The question is which one makes more sense for your situation, your health, your budget, and your doctors. Let me walk you through Plan G first. Here's what it covers on top of your original Medicare. Part A, coinsurance and extended hospital costs. Part B coinsurance, which is that 20% share that Medicare leaves on you. The Part A deductible, which is $1,736 per benefit period in 2026. Skilled nursing facility coinsurance for days 21 through 100. And Part B excess charges, which we're going to spend a good amount of time on in just a few minutes. When you add all that up, your only out-of-pocket cost for the year with Plan G is the Part B deductible. That's $283 in 2026. Pay that once at the beginning of the year, and after that, you're 100% covered. Now let's look at Plan N, and I want you to notice how similar this list looks. Part A, co-insurance and extended hospital costs are covered. The Part A deductible covered. Skilled nursing facility coinsurance covered. There are two differences between Plan G and Plan N, and they both involve your Part B outpatient coverage. First, Plan N covers your Part B coinsurance, but with a copay structure. When you go to a doctor's office and the visit is billed as an office visit, you'll pay up to $20. If you go to the emergency room and you're not admitted to the hospital, you'll pay up to $50. Second, Plan N does not cover Part B excess charges. That's it. Those are the two differences. Everything else is the same. Now let's talk about what those differences actually mean in practice. Part B excess charges are probably the most misunderstood topic in all of Medicare supplement sales. Some agents use them to scare people away from Plan N. So let me just explain exactly what they are. Medicare has a fee schedule. It sets the approved payment rate for every medical service. Most doctors sign an agreement with Medicare saying they'll accept that rate as full payment. Those are called participating providers. But some doctors don't sign that agreement. They still accept Medicare, but they don't agree to take Medicare's approved rate as full payment. Those are called non-participating providers. And when you see one of those doctors, they have the option to charge you up to 15% above the Medicare approved rate. That extra amount is the excess charge. Plan G covers that extra charge. Plan N does not. That's what we're talking about when we say excess charges. Here's something that most agents don't explain, and I think it's important. When a non-participating doctor sees a Medicare patient, Medicare actually pays them at 95% of the standard rate, not the full rate. So their 15% excess charge isn't 15% above what your regular doctor earns. It's 15% above that reduced 95% rate. When you actually run the math, the excess charge works out to about 9.25% above what a normal participating doctor would charge. What that means practically is that the dollar amounts involved are typically pretty small. And if you want to completely avoid excess charges with Plan N, there's a simple solution. Before you schedule an appointment with any doctor, just ask them one question. Do you accept Medicare assignment? If they say yes, they cannot charge you an excess charge, period. That one question asked before you book the appointment makes the whole excess charge issue disappear. Let me clear up some confusion here because I hear people mix these up all the time. There are actually three different categories of doctors when it comes to Medicare. The first category is participating providers. These doctors have agreed to accept Medicare's approved rate as full payment. Over 96% of doctors who bill Medicare are in this category. No excess charges are possible with these doctors, none. The second category is non-participating providers. These doctors accept Medicare but haven't agreed to take the approved rate. They can charge up to 15% above the rate. This is where excess charges come from. Less than 2% of Medicare doctors fall into this category, and more than 40% of those are mental health providers. The third category is doctors who have opted out of Medicare entirely. They don't accept Medicare at all. Medicare pays nothing toward their services. These are not the same as non-participating providers. They're completely outside the system, and they have nothing to do with excess charges. If you use one of the doctors that does not accept Medicare, you will pay the full bill. No Medicare supplement will cover that either. For your supplement to pay, Medicare must approve the bill first. When someone says they're worried about excess charges with Plan N, they're talking about that second category, less than 2% of Medicare doctors. I want to share a specific piece of data with you because I think it puts this whole conversation in perspective. Aetna, one of the largest Medicare supplement carriers in the country, analyzed their own claims data and published the results. What they found was that 99.34% of the claims they processed had zero excess charges, not low excess charges, zero. Of the 0.66% of claims that did have excess charges, the average amount of the excess charge was less than $20. That's not my opinion. That's industry data from one of the biggest carriers in the business. I've been doing this for 16 years. I've worked with clients in 46 states. In all that time, I have not had a single Plan N client call me and say excess charges caused them a real financial problem. Not one. The risk is real in the sense that it exists. But in practice, for the overwhelming majority of people, it simply doesn't come up. There are actually 8 states in the country where excess charges aren't just uncommon, they're illegal. The law in those states prohibits any Medicare provider from charging patients more than the Medicare approved amount. Excess charges can't happen at all. Those states are Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. If you live in one of those 8 states, excess charges are simply not a factor in this decision. Plan N and Plan G are identical from a coverage standpoint for you. The only difference is the premium and the office visit copay structure. And even if you don't live in one of those states, remember what we just covered. Over 96% of doctors accept assignment. One question before your appointment takes care of the rest. Let's talk about the Plan N copay because this is another area where I think people sometimes overestimate the impact. The $20 copay only applies when a visit is specifically billed and coded as an office visit. That sounds straightforward, but here's what it means in practice. Lab work doesn't trigger it. Imaging doesn't trigger it. Preventive care and most screenings don't trigger it. A lot of what happens at a doctor's office gets billed under codes that have nothing to do with an office visit. The $50 emergency room copay only applies if you go to the ER and you're not admitted to the hospital. If you're admitted, the copay goes away. Plan N covers the full inpatient hospital stay. And here's the math that really puts it in perspective. Plan N typically costs $50 to $70 less per month than Plan G. That's $600 to $840 per year in premium savings before you pay a single copay. You'd have to have quite a few office visits before the copays eat up those savings. Let me put some real numbers together so you can see how this actually plays out. Say you're a reasonably healthy person. You see your doctor 6 to 8 times during the year. No hospitalizations, just routine care. With Plan N, your costs for the year look something like this. The Part B deductible is $283. You pay that once. Your office visit copays at up to $20 each might run you $120 to $160 for the year. Everything else, the coinsurance on your other services, any hospital costs, all of that is covered by Plan M. So your total out of pocket beyond the premium is somewhere around $400 to $450 for the year. And meanwhile, you've been paying $50 to $70 less per month than Plan G. That's $600 to $840 you kept in your pocket on premiums alone. In a typical year, Plan N wins that math pretty clearly. Now let's look at a harder year. You're seeing specialists regularly. You make one emergency room trip that doesn't result in an admission. You've got ongoing care going on. With Plan N, the Part B deductible is still $283. Your office visit copays at higher usage might run you $200 to $300. The ER copay is $50. Everything else is covered. That puts your out of pocket somewhere around $530 to $630 for the year beyond the premium. And you still saved $600 to $840 in premiums compared to Plan G. Even in a busy year, Plan N is competitive. The premium savings are large enough that they absorb most or all of the extra out of pocket costs. Here's something that doesn't get talked about enough in this comparison, and it matters a lot over the long run. Of all the Medicare supplement plans available, Plan N has historically had the lowest rate increases over time. That's not just a starting premium advantage, it tends to stay lower. The reason makes sense when you think about it. Plan N has some cost sharing built in through the copay structure that tends to attract people who are a little more cost conscious about their healthcare use. Lower utilization means lower claims. Lower claims means the carrier doesn't have to raise rates as aggressively to stay profitable. The practical result is that the gap between Plan G and Plan N in terms of monthly premium doesn't usually shrink over time. It often grows. A $50 per month difference today might be $80 or $90 5 years from now. That's a meaningful difference when you're talking about coverage you'll be paying for the rest of your life. Before we get into who each plan is right for, I want to make sure you understand one more thing that most people don't know about Medigap premiums, and that's how they're priced. There are 3 different rating methods carriers use. Community rated means everyone on the plan pays the same premium regardless of their age. Your premium won't go up just because you get older, often the best long-term deal. Issue age rated means your premium is based on your age when you first enroll. It won't increase because you age, but it can still go up over time due to inflation and the carrier's claims experience. Attained age rated is the most common. Your premium starts lower, but increases as you get older. It can get significantly more expensive over time if you're not careful. Always ask which method a carrier uses before you enroll. It makes a real difference in your long-term costs. So who is Plan G actually the right choice for? Because it absolutely is the right choice for some people. If you're someone who wants complete predictability and you don't want to think about it, Plan G is your answer. Once you pay the deductible, you're done for the year. No copays, no tracking, no surprises at the point of care. For some people, that peace of mind is worth the higher premium. If you're seeing multiple specialists very regularly, like several appointments every month, the Plan N copays can start to add up. For very high healthcare utilizers, Plan G starts to close the gap and sometimes crosses over. And if you're in an area with a higher concentration of non-participating providers, urban areas and certain specialties can see a bit more of this. Plan G removes any question entirely. Now, who is Plan N right for? Honestly, the majority of the clients I work with end up on Plan N. If you want solid coverage at a lower monthly cost, Plan N delivers most of what Plan G offers for $50 to $70 less per month. That's real money and it adds up. If you care about long term rate stability, Plan N has the best track record of any Medigap plan. Lower premium now, slower growth over time. That combination is hard to beat. If your doctors accept Medicare assignment, and over 96% of them do, the excess charge issue simply isn't a factor. One question before your appointment and it's done. And if you understand that the $20 copay doesn't apply to lab work, imaging, or preventive visits, then you have a realistic sense of what your actual out of pocket exposure looks like. For most people, it's manageable. I want to be straight with you about where I land on this after 16 years and thousands of clients. I sell both plans. I get paid by whichever one you choose. I have no financial reason to push you toward either one. Here's what I've actually seen. Excess charges have never caused a real problem for any of my Plan N clients. Not once in 16 years across 46 states. That doesn't mean the risk is zero, but it does mean it's pretty close to zero in real life practice. Plan N is the right answer for most people. The premium savings are real. The rate increase history is genuinely better, and the coverage gap is smaller than most agents make it sound. But it's not the right answer for everybody. And that's the whole point of this video. The right answer is personal. It depends on your doctors, your zip code, your health, your budget, and honestly, how much you care about having zero question marks. That's exactly what we figure out together on a free call. If you're finding this helpful, hit the like button and subscribe so you never miss a video. We put out new Medicare education every week right here on Medigap TV. If you're ready to see what these plans actually cost in your specific area, here's what we do on a free call. We pull every Plan G and Plan N available in your zip code and put them side by side with real numbers, not ranges, actual rates from actual carriers for someone your age in your area. We also look at each carrier's rate increase history so you're not just picking the cheapest one today without knowing what it might cost you 5 years from now. Most people are enrolled and done in a single conversation. Our service is always free. We work for you, not for any insurance company. The links are in the description below. You can book a time directly on our calendar, or if you'd rather just call, the number is right there too. Ready to compare Plan G and Plan N rates for your area? All the links are in the description below. Option 1, book a free rate comparison call directly on our calendar. We'll pull every plan available in your zip code and walk through the real numbers with you. The Calendly link is right there in the description. Option 2, take the free Medicare Clarity Quiz. 7 questions, about 2 minutes, and you'll get a personalized starting point based on your specific situation. Go to mymedicaresupplementplan.org/Medicare Clarity. I'm Loran Marms, 16 years, 46 states, and I'm here to help you get this right. Thank you, and we'll see you in the next video.